Hello, and let's talk about the Supreme Court's decision to order free COVID-19 testing. One of the big questions that India has faced so far is, are we actually testing enough? Is the extent of the problem hidden due to the fact that we don't really know the true number of cases we're dealing with? Are we living with a false sense of security, confident in the belief that the government is handling the issue well? Very early on, the WHO had said that all countries must test. Have we done enough on this count? We'll discuss some of these issues further, but first here's some context. The total number of cases as of today morning was 5,734 in India, of which 5,095 cases were active. 166 people have died and 473 patients have recovered. The number of new cases yesterday was 540. Maharashtra has recorded the maximum number of deaths at 72, followed by Gujarat with 16 and Madhya Pradesh with 13. So far, India has tested just close to 1,28,000 people, with over 13,000 tests taking place yesterday alone. State governments are ramping up steps to control the spread of the virus. The Delhi, UP and MP governments have sealed hotspots in their respective territories. In Delhi, 20 areas have been sealed, which means people in these hotspots will not be allowed to leave their houses. District administrations have been directed to ensure delivery of groceries and essential items in these areas. The Brihan Mumbai Municipal Corporation, or the BMC, on Thursday declared 381 areas as containment zones. Meanwhile, we are learning more and more about the economic impact of the COVID-19 crisis. An estimated 11.76 crore people lost their jobs between March 22nd, just 2 days before the lockdown began, and April 5th. This is an estimate by the Center for Monitoring Indian Economy, or the CMIE, after analyzing reports from its periodic labour force survey. Yesterday, the Supreme Court heard a plea to make COVID-19 testing in private labs free of cost. It ordered the government to make sure that all testing was free. Until now, tests at private labs could cost as much as Rs 4,500, while tests at government facilities were free of cost. To analyze the impact of this decision, we talked to Dr. T. Sundararaman, the Jan Swasthya Abhiyan. Here is what he had to say. Thank you so much, Dr. Sundararaman, for joining us. So, first of all, the Supreme Court's decision was quite welcome yesterday, and it may. So, do you think it marks a major change in the amount of testing that might happen, or just because it's become free, does it necessarily mean that we could see a rapid increase in tests?
No, I don't think. First, I think it's a welcome decision. And I hope the government implements it in all seriousness. But somewhere I noticed in one of the television interviews that there is a restriction that the private sector tests only the samples referred to it.
Okay.
That would defeat the purpose. That would become another form of ensuring that the people tested and the sort of cases which are tested are kept under severe restrictions, and there is a systematic underestimation of the disease that is done. I think that the rule should be that the private sector is free to test anybody who has clinical symptoms suggestive of COVID-19, if the doctor prescribes it.
Right.
And that the government would be bound to reimburse the amount at a fixed rate. That rate can be negotiated. I think their present rate is 4,500. I'm sure they will be willing to negotiate a lower amount, but they should not charge anybody, because then there will be a tendency to overthink. But if their own physician, even a private physician, suggests that this is a COVID-19 differential diagnosis, then it should be tested. And I don't think the government should limit that test ability, but they should be reimbursed for it. Otherwise, they cannot test. It's fair enough. And there are standard ways of costing the testing. And at some point, we can work that out. We have worked out for differential diagnosis. It can be done immediately, but essentially, it is usually negotiated. It should be negotiated. But they should implement it and should not have restrictions on whom to test. Of course, government can refer patients to them for testing and say they will be duty bound to test whatever government refers. But they can, in addition, test anybody whom they think should be tested.
Right. So, also last time we spoke, which is about a couple of weeks ago, we had clearly marked that there was a huge testing problem in India, that we were under testing considerably. So, especially over the past 2 to 3 weeks, do you see that this situation has been ameliorated to some extent, or are we still progressing in the same way?
ameliorated to some extent is a very, very little it's nowhere near the scales we are talking about.
Right.
But it is increasingly clear that the restrictions on testing are not only test kits. They are also at some point to paint a profile of the disease as you would have it and not let thing go. So now, for example, even with severe acute respiratory infection, what is called SARI, not every SARI is being tested. There is screening, there is X-ray, and then only at one point after admission they are testing. Some states are saying we test only 50% of them, which is absolutely negligent. But even if you test all of them so late and such a strict criteria for testing, means, what does it mean? It means that people who have mild and moderate infections are walking around in the population. They are seeking health care. So they will appear as non-COVID patients before healthcare providers. And you would expect a lot of healthcare providers to fall sick. Is that happening? That is happening all over the place. The Cancer Hospital, Jaslok Hospital, Wokad Hospital. It was not people who were in the COVID-19 line of duty who have been quarantined. These are people seeing the general outpatient. Why? Because by design, you are allowing people who are mild and moderate cases not to be tested. Now, to the extent that the private sector laboratory testing allows those people to be tested, the government will lose control of the picture it wants to paint. For example, you have tested the Tablighi cohort, the patients who were there, see them as a cohort. That you have tested. To the extent that they were tested, it was well done. I'm not critical of that. I'm welcoming them. But there are many other cohorts. And to maintain a narrative that it is other than this cohort, there is no other cohort, we are actually not testing many people who have the symptoms but and deserve to be tested, need to be tested. If you open it up to the private sector, it is not the money of reimbursement that I think concerns the government.
Right.
It is opening up testing in a way that the narrative will spin out of the government control.
And in this context, could you talk a bit about the effectiveness of what are being called the quicker tests, which can be done much shorter but which have a much more, say, unpredictable set of results?
Okay, that's a good question. The rapid test is an antibody test. There couldn't be antigen test, but we don't have that. We have an antibody test. Now, that test, in the first phase of the disease, that is before symptoms develop, patient is infected for 2 to 3 days. And in the first 2 or 3 days after the fever develops, that test can give false negatives. Okay, so it's not a useful test in the early phase. So it's not a useful test for the first test of a quarantine patient.
Right.
But if a patient comes with symptoms, if the protocol is to test anybody with fever and likely symptoms after 3 days, then the test is very useful. So the test is never to be interpreted alone. It is to be interpreted in a clinical setting. And my contention is, despite the problems of negativity and positivity, it will be certainly a very, very valid test because tests are always interpreted in a clinical context.
Right.
Now, the other problem with the test is, suppose you test 6 months later, because it is antibodies, it will still be positive, though the patient is no longer infected. That's a false positive. But that's not really a false positive. It is actually telling a different story. You know that the patient is not febrile now, but you know, and if you are in doubt, you can always repeat with a viral test.
Right.
So a lot of severe cases are being handled in the ICU, and the test, COVID-19 viral test comes too late. But now with this rapid test, at least they will know they are dealing with it, and because by the time it is severe, it is usually positive. It will be positive. So they will be able to at some point pick, well, I don't know that they will be positive, but likely to be positive. So they will be much safer to do that. So I think the coming of this test is to be welcomed. And if we get the thing right, it's all right. Now, it should not be used for population survey and picking up early cases and then saying people are tested negative and that it's not a good test for a population survey. It's good test only in a patient who has developed clinical symptoms,
Right.
and or if you want to see at discharge whether the patient has developed immunity. As a research population survey, it's useful. It is useful in population surveys not to detect cases for quarantine, but to understand the spread of the disease, how many people have been asymptomatic, etc. It's a good test.
Right. So the Delhi government, for instance, has announced a plan to actually test nearly 1 lakh people at random. And this is almost close to what the entire country is tested. So do other states also, for instance, need to do that kind of mass testing at a random level?
It's not a very large number. You're talking of 2 crore population. You're talking of a population that is very near South Korea, which is 3 crores.
Right.
So you're not talking of a very large population. Okay. And Tamil Nadu has also ordered 1 lakh tests. Kerala has also ordered 1 lakh tests. Chhattisgarh wanted to order 50,000 or something. So a lot of people have ordered it. So this is still, I would still call this a minimal testing regime at 1 lakh. So I'm not going to say 1 lakh is too much. 1 lakh is possibly too little. Remember that for positive patients, you need 3 tests. So the number of people tested and the number of samples tested are not the same. There was a very interesting article that showed that it differed by only 890, absurd, obviously rigged. But you would test positive people twice more to ensure that they have turned negative to discharge them.
Right.
In quarantine patients, you would need to test on the 5th day and the 14th day to know that they are clear of the disease. So in some sense, you are talking of more tests per patient. Having said that, a random sample, if it is properly randomized and sampled, it is all right. But I would say that the emphasis should be on test. If you do totally random sample, then your pool is also uninfected people, infected and asymptomatic, and symptom. I would be happy if they were to do even all patients with symptoms, and symptoms defined in a liberal way, not make it too tight. For example, some people are putting breathlessness as a necessary symptom. It's not. It's not a necessary symptom for mild disease. So in some sense, if you within that you test, you would have done a great service. At least you would know the different cohorts. You would find that there is not one tablighi mafraf thing, but there are many such cohorts, and you would do justice to what you need to do in terms of a testing protocol.
Thank you so much for talking to us, Dr. Sundararaman. Meanwhile, in the US, which is the worst hit country by COVID-19, Senator Bernie Sanders ended his campaign to be the Democratic Party's candidate for the presidential elections. Sanders' campaign had enthused and energized millions of people, especially the youth in the United States, and brought them into politics. It had also provided an opportunity for social movements to raise radical demands that were far to the left of what was hitherto acceptable in US politics. We talked to NewsClick's Prabir Purkayastha on some of these aspects of the Sanders campaign. Prabir, thank you for joining us. And first, let's talk about Sanders' decision. In some senses, it was inevitable, especially after the COVID-19 crisis, because Sanders has always thrived on mobilizing large numbers. And the fact that it was never a big donor campaign, it was all about the smaller individual people and community organizing. And now all that has been badly hit because of the COVID-19 crisis. But it also points to a larger issue in the Democratic Party itself, because especially over the past few months, all levels of the party, including Obama himself, have been really involved in a concerted attempt to make sure he doesn't become the candidate.
It was very clear, particularly after the big set of primaries took place, that Biden suddenly had become from a faltering candidate who was not able to communicate, was doing poorly, suddenly from that point, he became the front runner. And the writing was that time itself on the wall that the Democratic Party, all sections, had combined together to see that Bernie doesn't become the candidate. They're willing to have a weak candidate against Trump. And it is always felt by people who study elections that Biden compared to Bernie would be a weaker candidate against Trump. So they're willing to do that, give Trump a second term. and not to have Bernie as a candidate. So it also makes clear that there is this political two-party system in the United States, which is how right you are and how more right you are. Yeah. And it is not that there is any possibility or an easy possibility of a left-wing platform to emerge, at least at the presidential level. It can emerge in the states, maybe in some of the Senate and Congress races, even at the local level, but having a national challenge to the two-party system, both of which happen to be different degrees of right or different degrees of connections to finance capital, that was not likely to be a scenario. Now, this has been a much bigger problem of the left, both, for instance, in the United States and the United Kingdom, that do people like Jeremy Corbyn, who's been a part of the Labour Party, and with Blair, the Labour Party also shifted to where the Democratic Party was. So do these people like Bernie and Jeremy, who call themselves socialist, still operate within this two-party system, which effectively these two countries are, or do they operate outside it? Both prefer to be within the parties. We always thought Jeremy should have left the Labour Party long back and formed a socialist bloc outside it, but he seemed to have proven us wrong by becoming the Labour Party leader, mobilizing the youth, challenging the Labour Party leadership, but it seems again that it has fallen back to the, shall we say, the old rut. So I think this is a larger challenge, that while there is a socialist ideological, much greater traction today in both these countries, that a true left party, how does it emerge? That is still a very open question, and it's very clear Bernie will be shut out of any leadership in terms of the presidential race, and the DNC has closed in behind Biden in spite of the, as I said, spite of the fact, very big questions on his winnability. So I think this is where it really rests, that the left in both these formations, the Labour Party and the Democratic Party, and there would be similar cases elsewhere in the world, has to take a call whether they can shift the policies from within or without. And it's also a call for the left, which is outside the Democratic Party. How do they actually take this up? And how do they build a left movement in these places? And Bernie could still, because I don't think he's going to run again as a presidential candidate. Yeah. So Bernie could still be the figure around which they could rally.
Mm-hmm. So the other issue is also that one of the major one of the major contributions of his campaign has been that there's been an immense amount of mobilizing around it. So even movements that don't maybe entirely agree with him, movements that are critical of certain of his positions, have nonetheless found the campaign an opportunity to mobilize considerably, to bring in a lot of young people. Now, many of these young people may not necessarily come out and vote in elections, but they're nonetheless involved in community organizing and other activities of this sort. So at some level, there is definitely an opportunity to build coalitions around these kind of movements also.
And also the fact that with the COVID-19 epidemic, the question of public health as opposed to the ill health industry. If you see the healthcare industry based on insurance, right, or the private health industry, medical industry that exists in the United States, including the pharmaceutical companies, they are not interested in health. They're really interested how to treat the ill. So that's why I'm calling it the ill health industry rather than the public health industry. So I think Bernie and others, the groups that we are talking about, even some of the people in the Democratic Party who have left positioning, they have all brought out the issue that this is the time to look at public health, and public health and capitalism are not coterminous. If you see that if you want a capitalist health policy, then certain diseases don't figure in that, and infectious diseases are the primary issue. Even when it comes to vaccines, you can see vaccines are not developed by the major drug pharmaceutical companies. They're being developed actually out of vaccine initiative taken either by governments or taken by essentially what would be called vaccine funds. And those vaccine funds have come from philanthropic organizations. So this whole attempt of making healthcare or public health basically not a public good, but something which is a part of philanthropy, that which rich people out of the goodness of your heart will give you, or the state's role should be restricted to only small part of it. I think both of these are open to challenge at the moment, and I think the left should use this globally to focus not just on public health, but the question of the capitalist system, which allows for these things to happen.
Thank you so much, Prabir. That's all we have in this episode of Let's Talk. We'll be back tomorrow with the latest news developments of the day. Until then, keep watching NewsClick.